When a stroke occurs, the blood supply to a specific part of your brain is suddenly cut off. This deprives delicate brain cells of the oxygen they need to survive. In the medical world, there is a saying, "Time is brain." Every minute that passes without blood flow can result in the loss of nearly 2 million neurons. However, while you are waiting for the ambulance to arrive, you are not helpless. There is a specific physical action, a trick based on the laws of physics and gravity, that you can perform immediately to help preserve your brain function. This action does not require medication or equipment. It simply requires you to change the position of your body relative to the ground. In this video, we will explain exactly what this lie-flat gravity assist is, why it works to stop the progression of damage, and the 7 other critical steps you must take in those first few minutes. We will cover why you must never take aspirin for a stroke, the specific order in which you should lock or unlock your doors, and how to prepare your medical history so the doctors can save your life the moment you arrive at the hospital. The lie-flat gravity assist. The immediate trick to stop a stroke from causing maximum damage before help arrives is to lie down completely flat. This technique is known as the lie-flat protocol, and it uses gravity to assist your heart in delivering blood to the brain. To understand why this works, you have to visualize your cardiovascular system. Your heart is a pump. When you are standing or sitting upright, your heart has to pump blood upward, fighting against the force of gravity to reach your brain. Under normal circumstances, your heart handles this easily. However, during a stroke, the blood flow is compromised. There is a blockage or a bleed that is restricting the amount of blood reaching a certain area of tissue. Surrounding the core area of the stroke, where the blockage is a zone called the penumbra. This is brain tissue that is stunned and starving for oxygen, but it is not dead yet. It is hanging by a thread. If you can keep blood reaching this penumbra, you can save that part of your brain. If you remain standing, sitting, or walking around in a panic, you are forcing your heart to work harder to push blood uphill. If your blood pressure drops even slightly, or if the blockage is severe, gravity will win, and that starving brain tissue will die. By lying flat on your back, horizontal, you remove the resistance of gravity. Your head is now on the same level as your heart. This allows blood to flow freely and with less resistance to the brain. It maximizes what doctors call cerebral perfusion. Even if a main artery is blocked, lying flat helps force blood through smaller collateral vessels to bypass the blockage and feed the starving area. Do not use a high pillow. Propping your head up with 2 or 3 pillows creates a bend in the neck, which can slightly kink the carotid arteries and restrict flow, similar to bending a garden hose. Ideally, lie flat with perhaps just a thin folded towel under your head for comfort, keeping the neck neutral and straight. If you feel the symptoms of a stroke, face drooping, arm weakness, speech difficulty, do not sit in a chair and wait. Do not go to the bathroom to splash water on your face. Lie down immediately where you are, or on a sofa, provided you are safe. This is the single most important physical action you can take. It effectively recruits gravity as a life-saving ally. This simple change in position can make the difference between a temporary injury and permanent disability. The unlock first rule. The second habit is a logistical rule that can save precious minutes. The unlock first rule. When a stroke hits, confusion and physical weakness can set in rapidly. You might feel okay one moment and then lose the ability to walk or speak clearly 2 minutes later. Many seniors, upon realizing something is wrong, immediately call 911. This is correct. However, after calling, they often lie down or sit in a back room. When the paramedics arrive 5 minutes later, they find a locked front door. If the paramedics cannot enter your home, they have to find a way to break in. They might have to wait for the fire department to arrive with heavy tools, or they might have to break a window. This process can waste 5 to 10 minutes. In stroke time, 10 minutes is a lifetime of brain function. Therefore, the sequence of events must be precise. Step 1. Call 911 or your local emergency number. Keep the phone with you. Step 2. While you are still mobile, go to your front door and unlock it. Open it slightly if it is safe to do so, or just ensure the deadbolt is disengaged. Step 3. Only then do you go and lie down safely. If you have a security system, disarm it. If you have a gate code, tell the operator on the phone immediately. It is a terrifying thought that you might pass out before help comes. By unlocking the door first, you ensure that even if you lose consciousness, the rescue team can walk straight in and begin treatment instantly. This creates a clear path for your rescuers. It removes a physical barrier between you and the hospital. This is a practical step that requires calm, quick thinking. The zero intake protocol, no aspirin. The third habit addresses a dangerous myth that persists among many seniors, the idea that you should take an aspirin if you feel a medical emergency coming on. While chewing an aspirin is the correct protocol for a heart attack, it can be fatal if you are having a stroke. This is because there are two types of strokes. The first and most common is an ischemic stroke, which is caused by a clot blocking a vessel. The second is a hemorrhagic stroke, which is caused by a bleeding vessel in the brain. You cannot know which one you are having without a CT scan at the hospital. The symptoms, numbness, slurred speech, weakness, feel exactly the same for both. If you are having a hemorrhagic stroke, a bleed, and you take an aspirin, you are thinning your blood. This makes it harder for the blood to clot and seal the leak. You are essentially pouring fuel on the fire, causing the bleed in your brain to expand rapidly. This can turn a survivable stroke into a fatal one. Therefore, the rule is strict: zero intake. Do not take aspirin. Do not take your blood pressure medication. Do not take anything. Furthermore, a stroke often affects the muscles in the throat and esophagus, causing a condition called dysphagia, difficulty swallowing. Even if you think you can swallow, your coordination might be off. If you try to swallow a pill or drink a glass of water, you risk choking. Worse, you risk aspiration, which means the water or pill goes down the wrong pipe and enters your lungs. This causes pneumonia, which is a major complication for stroke recovery. If you feel thirsty, do not drink. Wet your lips if you must, but do not swallow fluid. Wait for the IV fluids the paramedics will provide. Doing nothing is often safer than doing the wrong thing. It prevents the risk of worsening a brain bleed. This rule protects you from accidental harm while you wait. The time stamp technique. The fourth habit involves gathering information. When you arrive at the emergency room, the neurologist will ask one question above all others. What time was the patient last known well? This is not just for their records, it dictates the treatment. The most powerful clot-busting drug, TPA, tissue plasminogen activator, can only be administered within a specific window of time, usually within 3 to 4.5 hours of the start of symptoms. If you arrive and say, "I don't know, maybe a few hours ago," the doctors may be forced to withhold this life-saving drug because the risk of bleeding increases if given too late. Therefore, the moment you feel the symptoms or the moment you notice them in a loved one, look at a clock. Note the exact time. Write it on your arm with a pen if you have to, or type it into your phone. Symptoms started at 2:14 p.m. This precision gives the doctors confidence. They can calculate exactly how much time they have to work with. If you wake up with symptoms, this is trickier. Do not guess. The time is last known well. If you went to bed at 10 p.m. feeling fine and woke up at 7 a.m. with a numb arm, your last known well time is 10 p.m., not 7 a.m. This is crucial information. By providing a timestamp, you unlock the full arsenal of medical treatments. You prevent the doctors from having to guess. Here is a simple mental note that guides the doctors effectively: the box breathing stabilizer. The fifth habit focuses on managing your body's physiological reaction to fear. Realizing you might be having a stroke is terrifying. It is natural to panic. However, panic causes a surge of adrenaline. This adrenaline causes your heart to race and, critically, causes your blood pressure to spike. High blood pressure is dangerous during a stroke. If the stroke is caused by a clot, extreme pressure can force the clot deeper or damage the surrounding vessels. If the stroke is caused by a bleed, high blood pressure will make the bleeding faster and more severe. You must manually lower your blood pressure by calming your nervous system. The most effective way to do this is box breathing. While you are lying flat, waiting for the ambulance, close your eyes. Inhale slowly through your nose for a count of 4. Hold that breath for a count of 4. Exhale slowly through your mouth for a count of 4. Hold the empty lungs for a count of 4. Repeat this cycle. This rhythmic breathing stimulates the vagus nerve, which tells your body to switch from fight or flight mode to rest and digest mode. It physically slows the heart rate and relaxes the constriction of the blood vessels. Do not hyperventilate, short, fast breaths, as this constricts blood vessels in the brain. Slow, measured, deep breathing is the goal. This keeps your internal pressure under control. It prevents panic from worsening the injury. This works well for most older adults to maintain focus. The recovery position adjustment. The sixth habit is a modification of the lie flat rule, specifically for those who feel nauseous. A stroke, particularly one affecting the cerebellum or brainstem, can cause severe vertigo and vomiting. If you are lying flat on your back and you vomit, gravity works against you in a dangerous way. The vomit can pool in the back of the throat and be inhaled into the lungs. As we mentioned, aspiration pneumonia is a leading cause of death in the days following a stroke. If you feel even the slightest wave of nausea, or if you are caring for someone who is drooling or struggling to handle their saliva, you must use the recovery position. Roll onto your side, preferably the left side, though either is acceptable in an emergency. Bend the top knee to act as a kickstand so you do not roll onto your stomach. Place your hand under your cheek to support your head. In this position, if you vomit, the fluid will drain out of your mouth onto the floor or pillow rather than falling back into your airway. Keep your head aligned with your spine as much as possible. Do not curl into a tight ball. Just turn the body to the side to ensure the airway remains clear. This position protects your lungs. It accounts for the loss of muscle control in the throat. This is a vital adjustment for anyone feeling sick to their stomach. The meds in a bag. Grab. The seventh habit is about preparing for the handover. When the EMTs arrive, they need to know what you are taking. This is not just paperwork, it is life or death information. Specifically, they need to know if you are on blood thinners, anticoagulants like warfarin, Eliquis, Xarelto, or Pradaxa. If you are on these medications, your blood will not clot normally. If the stroke is a bleed, the doctors need to give you a reversal agent immediately to stop the medicine from working so the bleeding can stop. If they do not know you are on blood thinners, they might delay this step. While you are waiting, or if a family member is there, grab your medication bottles and throw them in a plastic bag, or have a written list ready. This is commonly called a vial of life or a medical card in your wallet. If you cannot speak when they arrive, hand them the bag. They will instantly look for blood thinners and blood pressure medications. This tells them exactly what chemical environment your body is in. Having this ready saves the hospital team from having to run blood tests to guess what you are taking. It speeds up the decision-making process in the ER. This habit streamlines your treatment. It ensures the doctors do not give you a drug that conflicts with what you already take. Here is a simple preparation step that changes the emergency timeline. The silent scan. Monitoring changes. The eighth and final habit is observation. While you are lying flat, breathing deeply and waiting, pay attention to your body. Stroke symptoms can fluctuate. They might get worse, or they might disappear entirely. If the symptoms disappear after a few minutes, you may have had a TIA, transient ischemic attack, often called a mini-stroke. This is a warning shot. It means a clot formed but then dissolved on its own. Do not cancel the ambulance if the symptoms stop. You are at extremely high risk of a major stroke in the next 48 hours. However, telling the paramedics, "My arm was numb for 5 minutes, but now I can move it," provides a massive clue about the nature of the blockage. Notice if the symptoms are spreading. Did it start in the hand and move to the face? Did you have a severe headache, often described as the worst headache of your life, right before it happened? These details help the neurologist map where the stroke is happening in the brain. Keep calm and simply observe. I can't feel my left leg. My vision is blurry in the right eye. Report these clearly when help arrives. This habit turns you into an active participant in your rescue. It provides data that scans might miss. Consistency in observation helps the medical team immensely. Conclusion: a stroke is a frightening event, but panic is the enemy. By taking immediate control of your environment and your body, you can significantly improve your chances of a full recovery. The moment you suspect a stroke, call 911 and unlock your door. Then, immediately lie flat to let gravity feed your brain with oxygen. Note the time. Do not eat or drink anything, especially aspirin. Breathe deeply to lower your blood pressure, and if you feel sick, turn to your side. Have your medications ready and observe your symptoms. These 3 minutes of focused action bridge the gap between the onset of the stroke and the arrival of professional help. You are not just waiting, you are actively fighting for your brain health. If you know someone over 50 who lives alone, please share this video with them. It is knowledge we hope you never need, but it is vital to have. And subscribe for more simple health tips.